The mechanical illusion. Why we keep treating chronic pain like a broken machine. The prescription was brief, almost innocent. Physical therapy for mechanical diagnosis and treatment. No malice in it, no arrogance, just certainty. And yet, it quietly revealed the lens through which we still try to understand a problem that no longer behaves mechanically. The comfort of levers and gears. The mechanical model is seductive because it promises clarity. Find the faulty part, correct the alignment, reduce the friction, restore the system. It works beautifully for fractures, acute sprains, surgical repairs, or acute tissue injury. In those moments, the body behaves like matter. But chronic pain does not behave like matter. It behaves like memory, when the machine doesn't explain the experience. My patient had hip osteoarthritis, lumbar degenerative changes, and years of persistent pain, and yet her pain did not map cleanly to structure. It rose and fell with stress, sleep, fear, expectation, memory of previous flares, or the way she interpreted her body that day. The machine was quiet, the system was loud. The dangerous assumption. The mechanical model assumes that if pain persists, something mechanical must still be wrong. So we keep searching, more imaging, more labels, more corrections, more fixes. And when nothing resolves it, the conclusion quietly becomes, this is irreversible. But irreversibility is a mechanical concept. Learning systems do not obey it. Chronic pain is not a broken part, it's an overprotective pattern. In long-standing pain, the nervous system is no longer simply reporting tissue status. It is predicting threat. It is comparing the present with remembered danger. It is interpreting movement as risk before movement even occurs. It is amplifying signals that once protected and now imprison. This is not failure. This is adaptation that outlived its usefulness. Mechanical systems cannot recalibrate predictions. We keep searching for the wrong culprit. When patients don't improve under a mechanical frame, the blame often shifts to noncompliance, poor biomechanics, weakness, degeneration, their posture, their core, etc. Quietly, the system implies that if they're still in pain, it must be because they're still broken, and the patient absorbs that meaning perfectly. The mechanical model is not wrong, it's incomplete. This is the uncomfortable truth. Biomechanics matter. Tissue capacity matters. Loading matters. Structure matters. But they are inputs, not the operating system. In acute pain, mechanics dominate. In chronic pain, prediction does. Treating chronic pain with a purely mechanical lens is like trying to change software by tightening screws. The cost of mechanical certainty. Mechanical explanations simplify the clinician's task, but they complicate the patient's life. They teach fragility instead of adaptability, caution instead of exploration, dependence instead of agency. They quietly suggest the body is a structure to be fixed, not a system to be retrained. The unseen mismatch. The most dangerous gap in modern pain care may be this. We are using 20th century mechanical metaphors to treat 21st century neuroadaptive systems. And then we wonder why patients remain stuck in loops. A different kind of clinical skill. What chronic pain often requires is not finer mechanical correction, but deeper system literacy, the ability to recognize threat patterns, reshape expectation, rebuild trust through graded exposure, restore agency through safe contradiction of fear, or help the nervous system gather evidence of safety. None of that shows up on an X-ray or MRI. Quiet consequence. When a patient with years of pain is given a mechanical-only frame, something subtle happens. They stop listening for capacity. They start listening for damage. They become caretakers of a deteriorating structure instead of participants in a learning system. And the loop tightens. The tragedy is not that we use the mechanical model. The tragedy is that we often stop there. We treat long-standing pain as if it were a delayed version of an acute injury instead of a reorganized nervous system with a long memory. And so we keep adjusting parts while the prediction engine keeps humming, untouched, unchallenged, unchanged.